This program is brought to you by Community Trust Bank, Medical City, and the Neely School of Business at TCU. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Hey, welcome back everybody to Platforms, the life-lifting news program for women. We're continuing our conversation here at Medical City Children's Hospital, talking about a terrific program called FACT. Our next guest is Dr. Claire Schwindeman. Dr. Schwindeman is a neonatologist here at Medical City Children's Hospital. Dr. Schwindeman, welcome.
Thank you, Sean.
I practiced your name all night last night, so I hope I got it correct.
Yes, you did.
All
yes.
right. All right. Again, by design, I'm the layperson here, so why don't you explain to our audience first what a neonatologist is?
A neonatologist is a pediatrician who's had additional training to take care of babies that have problems after birth. They can either be premature babies or they can be babies that are born on time or at term who have some conditions that need some medical assistance.
Okay. So when you were studying medicine, why did this particular area appeal to you? Pediatrics, obviously, and then this subspecialty.
I like the intensive side of medicine, and pediatrics was fun because you can assist the babies and generally try to give them a very good life ahead. And it's fun and it is very rewarding.
Mm-hmm. Okay, now let's talk about the FACT program. Your colleagues, Dr. Mendeloff and Dr. Weiss, we've spoken with them earlier. This FACT program is quite remarkable, and your position in the program, you've kind of been described as the conductor of the orchestra, would be a good analogy. Why don't you explain to the audience how that works?
Well, what the neonatologist does, or what we try to do, is we try to orchestrate the care. We are at the delivery of the baby, and we are the first people there to make sure that the baby transitions from birth to life in a normal fashion. If there's any concerns or problems there, we intervene and we try to stabilize the baby. And then we invite the other doctors in who look at the heart, look at the intestinal tract, and take care of the baby that way. But we provide sort of the overall care, and we make sure that the baby's taken care of by nutrition, their heat, and just overall make sure that everything works right so the overall care of the baby is done.
And I understand that Medical City Children's is one of the few in the nation that has this FACT-type program. We had an opportunity earlier to interview a mom who, young Asher is one of your patients here, 4 weeks old, and he underwent 2 major surgeries. So I guess this whole integrated approach is critical for not only the patient but the health of the extended family.
Yeah, we're very fortunate here at Medical City because we both have an adult hospital and a children's hospital. And so the mother, if she has any medical concerns, obstetrical or other medical concerns, can be taken care of. She can be delivered here, and then immediately the baby can be taken care of too on the children's side of things with all the various subspecialists we have here. So the mom can be with her baby immediately after delivery, and there's not a separation there.
That's terrific. And also you have a neonatal transfer unit, I understand, where you can actually bring the baby to Medical City Dallas and then create this home environment for the mom and other family members.
That's correct. When babies are born in an outlying hospital or other places where they need neonatal care or high specialty care, we can transport them in here very safely. It's basically like a moving intensive care nursery.
So it's either via helicopter or ground? It's air and ground?
Yes, we have both capabilities. So yeah, we can go get them by helicopter or ground, and we have a specialty team of nurses that are trained both in pediatrics and neonatal care that do the care during the transport, managed by the neonatologist. Yeah.
Would you, I know you work with so many families and children. Is there any particular case that really resonates with you that you can kind of share with our audience from the beginning to where the child is now today?
Well, we had a baby who was born at term or at his due date, and he was known previously to have an abnormality in his heart. The abnormality in his heart in most babies is not a big problem and can be repaired probably towards the latter part of the first life. Unfortunately, in this child, he was a little unique, and he was born in another hospital here in Dallas and was transferred to us because of the heart surgery program we have here. And we had multiple subspecialists visit with him, the heart doctors, the heart surgeons, and he was a little perplexing because he wasn't the usual.
How old was the baby at the time?
He was about a week old when he came to us.
A week old?
Week old, and
Wow.
up to that week, he had basically been a normal newborn baby. He was stable in just regular amount of oxygen that we breathe. He was actually taking his feedings, and then he became sicker and had more problems, and so he's transferred to us about a week of age. But he's now been in the hospital for about 4 months now, and he has had a heart surgery, He has had surgery to stabilize his breathing tube or airway, and he's going to have several other surgeries because not only was his heart abnormally built, but he has reversal of all the organs in his abdomen. So everything is built backwards.
You're kidding.
Yeah,
No,
and
but the
so-
organs they grew inside the abdomen. They weren't on the outside, but they
No.
were just in reverse order.
Yeah, they're all
Wow.
contained within, but they're, instead of having his liver on his right side, his liver's on his left side, and his stomach is over here, so everything is reversed,
So the balance
including
of
his heart.
Wow. Okay, so that was a second surgery then, obviously, after the heart was taken care of?
Well, yeah, he had a second surgery to stabilize his breathing tube, or what we call trachea. Basically, his heart was so big that his heart was pushing on his main windpipe.
Okay.
And so he was having difficulties breathing. And so in order to try to stabilize and correct that, he had to have a surgery where a permanent breathing tube or tracheostomy was put in. And then he still got, at this point now, he's recovering from his heart surgery and doing very well with that, but he's still got probably at least another 1 or 2 surgeries to go in order to get him home. But he's now been with us for about 4 months.
It must be gratifying with I don't know how many years you've been in medicine, but particularly with technology these days as it relates to pediatrics. I mean, what are some of the new exciting technologies that are really helping these infants recover and be able to lead normal lives?
Well, I started in 1988, so I've been doing this for a while. And at that point, we felt we were successful if we could save a baby who was 32 weeks or about 8 weeks premature. Now we're down to 23 weeks.
23 weeks.
23 weeks, yes. And now the 23 to 24 weeks is sort of pushing the envelope, but still at that age level, 25 to 50% of those babies will survive. We didn't have the type of surgeries that Dr. Mendeloff does. We didn't have a lot of operations for some of the congenital heart disease patients, and we couldn't offer them anything except to take their baby home and the baby would pass away. And so between the capabilities that we've had with dealing with the very premature babies and then the other babies with heart conditions and things, it's made a tremendous outcome in the babies who survive, and also not only the babies who survive, but their outcome.
That's
It's much better.
remarkable. So once this young child that's still here, and it's going on 4 months that this particular patient is under the care here at Children's?
Yes.
Okay. So once he goes home, like many of your colleagues have said, the relationship continues with the family as the child grows. I mean, it's an ongoing relationship through this FACT program, it sounds like.
Yeah, that's correct, because this baby's going to have continued care with the heart doctors. He may need a second heart surgery. He's also going to need definitely with the ear, nose, and throat doctor for breathing concerns, lung doctors. Yeah, he's going to have all these physicians. Right now he has about 7 or 8 physicians who are involved in his care. And all those physicians pretty much will be seeing him then when he's discharged.
You know, I haven't asked this yet of any of your colleagues, but how do you compartmentalize? I mean, you're in an area where you see life and death quite often, and especially if you unfortunately lose a young patient. How do you as a physician, are you able to compartmentalize emotionally so that, you know, because it can be difficult sometimes?
Yeah, it can. You get used to some patients you have a bond and stuff with.
Right.
Others, again, you know sort of in your own mind that it's best for the baby if they should pass away.
Right.
That there's some babies that unfortunately you just can't do things for. And so you have
And maybe
to
it's
get
a
adjusted to
quality of
that.
life issue.
Yeah, it is a quality of life.
How has it impacted you in terms of your own view of life and the quality of life and how precious life is? Does it give you a different perspective?
I think it does. I mean, for me, I've always said this is, if I'm not going to have a quality of life, then I'm not sure that I want my life to continue plugged up to machines and things like that. So I do very much in my own personal beliefs stress quality of life.
Right.
And look at that as a focus. So I know different people have different opinions and things like that, but to me, quality, not just life, is very important to these children and their families. Yeah.
Well, Dr. Schwindeman, I will leave on that note. It was an absolute pleasure having you on the show, and if our audience wants to get a hold of you or your team here, obviously they can contact Medical City Children's Hospital and get more information. And it's been an honor having you on the program.
Well, thank you very much for allowing me.
Thank you.
Thank you.
Ladies and gentlemen, I'm Siobhan Palmer with Platforms, the life-lifting news program for women. We'll be back in a moment.